Edsel Salvania to make his presentation with the clinical features of the Delta variant. We can, with your permission, sir, we would like to acknowledge Dr. Salvania to make his presentation. You have the floor, Dr. Salvania.
Thank you, Mr. Chair. Good evening, Mr. President. Good evening to the Cabinet and members of the IATF. May I have the slides up, please? Okay, Mr. President, this is actually an update of what I presented to you before about itong nakakatakot po natin na Delta variant. We know more about it now, and what we are seeing is continuing to be scary. We call Delta the fastest and the fittest virus po na na-produce ng COVID-19. It is 60% more transmissible than Alpha, yung UK variant, which is already 60% more transmissible than the original virus. It is 3 times more contagious than the original SARS-CoV-2 virus. It also seems to be deadlier, and this will be worse if the healthcare system is overwhelmed. Patients also seem to get sicker, and younger ages can also develop severe disease po, Mr. President. Next slide, please. So ito po yung nakakatakot sa Delta kasi alam natin the original virus from Wuhan, it can infect about 2.4 to 2.6 people. Yung sa Europe 3, yung Alpha na UK variant, it can infect 4 to 5. Itong Delta up to 8 people po pwede niyang i-infect. And those 8 can each infect another 8. Kaya nakikita po natin yung sa India, yung nakikita natin sa Indonesia, ang bilis-bilis po talaga ng spread, exponential po talaga ang spread. Next slide, please. So, ang nakita po, there was an outbreak in China, and we know naman China has a very good healthcare system. Nagkaroon pa rin sila ng outbreak of about 168 people, pero mukhang na-contain naman po nila. But what they found was, yung Delta has 1,000 times more virus particles than the original virus. Kaya ang nakakahawa po talaga, there's also a longer duration of infectiousness. There is also a faster time from becoming infectious from the time you're exposed. Dati, it takes about 3 days bago ka nakakahawa ng mga tao. Ngayon, mga 30 hours lang pwede nang makahawa. And of course, there's a lot of virus. So even asymptomatic pa lang, nakakahawa na po. And yung sinasabi natin dati na close contact na at least 15 minutes, that is really out of, nakita po nila even in Australia and in China. Minsan 1-2 minutes lang pwede na pong mahawa. So this is a very contagious virus po. Next slide, please. So in summary po, we know Delta is more transmissible, it's potentially deadlier, and can spread quickly faster. But it is beatable with our minimum health standards. Face shield, face mask, physical distancing, and of course, we have to vaccinate everyone. We just really need to make sure na mag-level up rin po yung ating compliance because the virus has really leveled up. The treatment remains the same. Deaths are going down in countries with high vaccination rates. So tama po yung ginagawa natin. Continue to vaccinate. We were more cautious with relaxing our measures. Yung sa US, nagtanggal na sila ng mask. Even though mataas yung vaccination rates nila, that was the wrong thing to do. Lalo na with Delta kasi pwede pang mahawa. So I think at least in the short term, until we can vaccinate more and more people, we should continue to vaccinate as fast as possible, use our face masks and our face shields, and hopefully we can avoid a surge that is really devastating our ASEAN neighbors po. Thank you very much, Mr. President.
Thank you, sir.